For 40 years, the swing bed program has been impacting rural America. But swing bed is not a literal term. It actually describes a payment model for transitional care, the swing bed program. When a patient is well enough to leave the hospital, but not well enough to be safe at home, the swing bed program allows rural patients to receive subacute care in their local hospital, often in the same bed and with the same staff. As part of the 1981 public-private partnership making the swing bed program a reality in hospitals across rural America, John Supplett shares his perspective of what the swing bed program has meant for rural patients and the rural hospitals that serve them.
It goes back to 69-70, when Dr. Walter was looking at ways in which they could do two things: maximize using the resources and the unused capacity of inpatient hospitals in frontier Utah, but at the same time putting the patient at the center. And Dr. Walter was, seeing the transportation issues and the referral situations in which, if a skilled nursing facility could no longer manage or didn't have a vacancy for a skilled nursing patient in a remote frontier community, that patient then was referred to the next largest city. You could take medically complicated patients who were elderly and frail and needed that transition between inpatient acute and skilled nursing. And swing beds provided a way to do that. And so it was really a subacute care model. And that's how it was used early in these demonstrations, and really how it continues to be used, some 30 years later, is that it allows the patient the opportunity to make that transition from inpatient to subacute to skilled nursing to assisted living.
Also a part of the 1981 Swing Bed Project's partnership, registered nurse Frances Rogers Seidel shares her experiences from guiding implementation efforts in rural hospitals across the country.
They're in their own community. They don't have to go to the big city hospital, that they can get their care right there in their own community. They know their caregivers. And so they still own their personhood. It really is helpful in healthcare to have that recognition of the person as a person in their own community.
Allowed especially local patients to stay close to home as opposed to going to some faraway tertiary care hospital 100 miles away. It really allowed them to care for the people that lived close by.
If you want to look for innovation, just look to rural. You have to be resourceful, you have to be resilient, you have to have ingenuity, you have to be able to collaborate with one another in order to make these systems work when you have low volume and limited and scarce resources. So it doesn't surprise me in the least to see that swing beds became a very important innovation that emerged from rural communities back, in the 70s.
I'm sure it was around economics and access. Those two things tend to be the things that drive everything. The role of CMS and Medicare in bringing the swing bed program into play was actually putting together a reimbursement model that would support the need. You had the need, but you had to have the finances that played behind it. And so the swing bed program was able to put the financing around it to make it work in a hospital setting, whereas a freestanding entity may not be able to survive back at that time.
And it's something that I'll give Medicare credit for that in terms of establishing that many years ago as a way to say, okay, we understand that sometimes it's just not practical to send that patient out to a nursing home. And so they allowed that as a different way to essentially allow us additional payment beyond the DRG payment to provide a lower level of care to those patients.
I think the other thing was their cry of, we're not going to be a nursing home, are we? And for me to keep saying, you're not a nursing home. You'll not be a nursing. you're going to have patients here need continued care. And you know how to do that. All of the swing beds were a research project. And the question was, could they give as good a care as nursing homes?
Swing beds really became a subacute mode of delivery very quickly, and that has been sustained over time, and it has served the patient extremely well in that respect. The positives that really were driving and inspiring swing beds were, as we mentioned, the patient-centered approach to care, the ability to coordinate that care over at different levels, from inpatient acute through post-acute through home health and discharge. The ability to maximize our resources, both human and our physical assets, and really to address really some social determinants of health, and in this case it's transportation most obviously. Those were really the foundation of what this new model of care and delivery represented.
Think about the people in your town. Now they can stay with you. They don't have to go anywhere. They can stay with you and get well.
As one of the largest employers in my community, that really helps to stabilize our workforce, because by number, we're not the largest in our community, but by the fact that we have the highest number of highly educated or licensed personnel puts us we're the highest payroll in our area. So that really helps to stabilize an economic downturn, as long as we can keep family members close, taken care of by local people, and that keeps local jobs. That helps to strengthen an economy.